Hello everyone and welcome back to my channel. Just to let you know that I've reposted a previous video called Class 2 Cavity Preparation, Principles of Cavity Preparation, as there was an issue with the video. The logo of the software company that I use to edit the videos was present, so the images were in the video itself wasn't too clear because the logo was present in the middle of the screen. So my apologies for that, and please, I do hope that you enjoy that video. In the next clip, I want to show you two teeth, an upper right one and upper right two, that were endodontically treated, and the treatment had to be redone due to the teeth being symptomatic. Both teeth had root fillings that were short and poorly compacted, and the patient presented in a clinic with a draining sinus. I hope you like it, and please, if you like my videos, please subscribe to my channel. Thank you very much. So the first thing to do is get access to using high speed and low speed bursts. We can get access to the chamber, and immediately after this to the canal. The initial removal of gutta percha from the coronal and even sometimes the middle third of the canal can be done with Gates Gleeden, as we can see here in this part of the video. The Gates Gleeden can be different sizes, can be used depending on the size and the perceived size of the canal. Once we've reached the apical third, sorry, we can start using hand files. In this particular case, the you see me here enlarging the access cavity on the palatal axis of the tooth up to the incisal edge of the tooth. As this will allow, in certain cases, certainly in this particular case, a better straight line access to the apical third. Again, you'll see me here enlarging the access cavity even more, all the way, and this time to include the incisal edge, to allow a better access to the apical third of the tooth, and better visual access to the apical third of the tooth, and better access for needles for irrigation. Once in the apical third, we can use, as I was saying before, we can use hand files with a solvent to remove a gutta perca from the canals. And once we've reached the apex, we can use our apex locator to estimate the working length, and with the use of wave 1 files, we remove the last remaining tags of gutta perca, and we can also instrument the canal as per normal protocol. So we can see there that we have a very good view of the internal walls of the canal all the way down to the apical third, and this facilitates the proper irrigation and the removal of tacks of gutta and cement. Hand files can be used to ensure that our tooth is patent, that our apical third is patent, that we haven't lost working length. And in this image you can see the upper right one was temporarily closed with calcium hydroxide paste and a temporary fill in cement. The patient was recalled for a second appointment, and we can see here the same process is carried out in the upper right tooth. We use the Gates Glidden to remove the coronal aspect of the root filler material, and even the middle third, of the root filler material. The Gates Glidden can also be used to slightly enlarge the palatal wall of the canal to ensure that we have better access to the apical third. You'll see me here with this tooth, with upper right tooth. I also enlarge the cavity, the access cavity to the incisal edge, and this is usually done when the long axis of the crown and the root are not parallel to each other, and in difficult cases, like for example like a retreatment. So again, with the Gates Glidden, we proceed down into the middle third of the tooth, or the root, I should say. And as mentioned before, you'll see me here using a diamond burr to enlarge the access cavity and to bring it all the way to the incisal edge to allow better access for instrumentation in irrigation and visualization as well of the apical third. The irrigant that I like using the most is sodium hypochlorite. Sodium hypochlorite will disinfect the canal, dissolve organic material. It will soften, to some extent, it will soften the gutta perca, and it will also whiten the internal surfaces of the tooth. So it gives a good number of advantages over other irrigation materials. And again, once the apical third has been reached, we can use our wave 1 files for the use of, or for the instrumentation and the preparation of that apical third. Here we can see the rubber stop in the file, clearly indicating that the working length has been reached, and always using irrigation and recapitulation with hand files to ensure the patency of our canal. And once we're there, once we're happy with our instrumentation and the preparation, the biomechanical preparation of our canal, we can fit our cones. An X-ray is always advisable to take an X-ray. It's always advisable to take an X-ray to ensure that the cone fitting is ideal. That was done in this particular patient. It wasn't shown in the video, but it was done. I always do it. And once we're happy with the cone fitting, we start our obturation process as described above, or in previous videos, with vertical compaction of gutta percha, followed by a backfill of thermoplasticized gutta percha. And you can see our initial preoperative X-ray. We can see a large periapical lesion and the root filling material being defective, and this is our final X-ray. We can see there is better packing of the filling material and to the proper length of the roots. I hope you enjoyed that video, and if you have any questions, please drop me a message.